Welcome everyone, and a special welcome to our Follette School alumni. I'm Susan Yaki, the director of the Follette School Public Affairs, and I'm also a faculty member at our school. I'm delighted to be moderating our event tonight. Before doing so, I wanted to take a quick opportunity to give you an update on what's happening at the Follette School. Y'all know already that the Follette School is the home for public policy research and teaching on UW-Madison's campus. We're one of the top policy schools in the world, and we educate graduate students across 2 master's programs, as well as UW-Madison undergraduate students in a brand new certificate in public policy program as well. At present, our school is experiencing a lot of growth. We've doubled the size of our faculty and over doubled the number of students that we're serving, all within the last year. Part of this growth has been funded by a $10 million investment in our school from former Senator Herb Kohl, and we're so thankful and grateful for that gift. One of the things that this gift does is enable us to have a greater dialogue around society's most pressing problems. And given that mandate, I'm thrilled to introduce our panelists tonight. I bet some of them look familiar to you all. Dennis Dresang is Professor Emeritus of Public Affairs and Political Science and was the founding director of the Follette Institute of Public Affairs. His research focuses on state politics, public personnel management, and community issues. He joined the UW-Madison faculty in 1969 and retired in 2008. His tenure included 3 years as director of the Center for the Study of Public Policy and Administration, which became the Follette Institute and later the Follette School. Welcome, Dennis. Bob Haveman is Professor Emeritus of Economics and Public Affairs. His research includes public finance, the economics of environmental and natural resource policy, cost-benefit analysis, and the economics of poverty and social policy. He joined the Follette School faculty, well, actually the UW-Madison faculty, in 1970, and he retired in 2004. His tenure included 3 years as director of the Follette Institute of Public Affairs, which later became the Follette School. Bobbi Wolfe is the Richard Easterling Professor of Economics, Population Health Sciences, and Public Affairs. Her research focuses broadly on poverty and health issues, including how poverty influences critical brain areas among young children and the impact of the Affordable Care Act. She joined the Follette School faculty in 1990 and served as its director for 2 years. Geoffrey Wallace is Associate Professor of Public Affairs and Economics. His research focuses on labor economics, the economics of marriage and family, and policy issues related to poverty. He's well known amongst our recent alumni for teaching the Follette School's Advanced Statistical Methods for Public Policy Analysis course. Geoffrey has been with our Follette faculty since 2000. And last but not least, my colleague John Witte is Professor Emeritus of Political Science and Public Affairs. His research focuses on tax policy and education policy, including school choice, vouchers, and charter schools. In 2010, he helped start the School of Humanities and Social Sciences in Kazakhstan, and he served as its founding dean. He joined the UW-Madison faculty in 1977 and retired in 2012. His tenure included 3 years as director of the Follette School of Public Affairs. Welcome to our panelists. Our first question tonight is going to be answered by each of our panelists in turn. We're going to start with Professor Driesang, Dennis, and then follow that with Bob and Bobbi, Geoffrey, and John. And here's that question. We're going to dive into our topic right away. How has the pandemic heightened the importance of public policy? And how do you anticipate the role or perception of public policy will be different in our post-pandemic world? Dennis?
There. Thank you, Susan. And thank you very much, by the way, for all that you have done, which is an incredible amount of very successful, hard work to build the Follette School to what it is today. Great job. When I think about this, the responding to this question, I'm reminded of the contribution that the Follette School made in the 1998 to 2002 effort to unify public health in Madison and Dane County. They had been separate up until that point. I was asked to be the co-chair of the special commission or task force to consider unification. And we used a lot of La Follette students, some of whom are probably participants in this webinar, to, on the one hand, determine whether or not it was a good idea. That turned out to be a no-brainer. And then to deal with all of the public management issues that were involved. Madison and Dane County had different services that were public health. They had different personnel forces. They had different and incompatible database, data management systems, different accounting, different budget. And so what we did over that 4-year period is go through in detail and help the city and the county unify their services, which they did. And that exists today. Just imagine, I mean, we all are familiar with the absolute confused rollout, particularly in distributing the vaccine. And just imagine what that would have been in the Madison area had we still had separate public health services for Dane County and for the city of Madison. And I think that going forward, it's clear that we ought to be taking lessons from our own particular experience and think about ways in which we can have a much more coherent, cohesive, and coordinated effort in the region and really in the United States so that we can indeed increase the chances that people are not going to get get caught up in the pandemic.
Bob and Bobbi, how about you? And let me restate the question so everybody knows it. How has the pandemic heightened the importance of public policy, and how do you anticipate the role or perception of public policy will be different in our post-pandemic world?
Thank you, Susan. It's a delight to be here this, well, it's afternoon here, evening is soon arriving. I'm just going to take a focus on the healthcare sector and the pharmaceutical sector. And I think that the pandemic has really highlighted some of the really important issues and the need for public policy to pay attention and to change in some cases or to modify in other cases. We can think about health insurance and how the people who haven't had coverage have been hit through the pandemic. We can think of the policies that, because Medicaid is largely state determined, how the inequalities there have affected people's health and their risk level and in fact their overall well-being throughout the pandemic. I think another one though that I'd like to highlight, just because I think people don't tend to pay as much attention to it, is really the pharmaceutical sector, or that more specifically has been involved in vaccine development. I think that through the pandemic, we've been made aware of the major role of public funding. And we have public funding. I think I just read a statistic that said for all the new molecular entities that were developed between 2010 and 2016, 100% of them, all 210, had some funding for NIH. And we know that academics are involved. So we have the question about how should they be funded? Then we have the next question about how they should be further developed, because there's the basic research, then there's the more applied research, but then how are they priced and how are they distributed? So I think that the pandemic has really raised the visibility of the whole pharma sector and these issues, and that we ought to be creating opportunities it has created opportunities for people to listen to the importance and to develop better policies for this sector. Go ahead.
I'm next.
I don't think I can see you very well.
Let me second Dennis's point about the job that you've done at La Follette, Susan. You've been a super director. Yep. And I just want to compliment you on that. During the pandemic, the economy was hard hit. Many job losses. The unemployment rate rose a lot. As a result, the poverty rate also rose a great deal. The increase in the poverty rate fell mainly on low-wage workers. They are the poor, and the poverty rate soared. Unusually, the poverty rate has not yet started to come down. This has meant a lot of hardship. It certainly opens up the door for a lot of economic input to figure out what went wrong, mainly macroeconomists, something that the Follette School doesn't specialize in. Anyway, it's been one of the main impacts of the pandemic and caused much hardship. Thank you.
So I love our answers so far. If Denny is starting with public sector organizations and public management, and Bobby's adding in health policy, and Bob is adding in, the economics of poverty. This is a Follette School answer so far. The next person in line is Geoffrey. Geoffrey, what do you think of our question on the pandemic's height?
So I'm going to take it in two parts. Address the first part. What did the pandemic do to highlight the importance of public policy? I think a number of things. I'm going to kind of piggyback on what Bob talked about in terms of poverty, but also inequality. Really long economic expansions are really good for low-wage workers and people at the bottom of the income distribution. And we pretty much saw that. We got to a child poverty rate, I think, of 14.5%. That's a historic low. We're less than, as of 2019, less than 20% poverty among African Americans. But the pandemic kind of brought all of these problems of poverty and inequality back into focus. So because it increased disparities along a number of dimensions and in multiple outcomes. And I'll just say the murder of George Floyd also caused the country to take another look at racial inequalities or inequality along racial dimensions. So I think that's an important part of this. Secondly, the pandemic created problems that only government and especially the federal government can solve. These problems include things, and we saw this with kind of what I view as a botched federal response early on, like the problem of states competing over PPE and ventilators and things like that. That's something that only the federal government can solve. Also, how to facilitate, provide guidelines that facilitate keeping people safe, how to reopen schools, both at K through 12 level and also at the university, how to kind of stimulate vaccine creation and also distribution is another problem that probably only the federal government could solve, and how to keep workers in their jobs. Because once the job ends, then that's another burden. People have to find another one. It's much better if they can stay with their jobs. And then there's also kind of a looming fiscal crisis for all kinds of state and local entities, including the UW, that probably only the federal government can solve. So I think it's really highlighted the role of the federal government in policymaking. And just to kind of sum this up, in short, the pandemic created a policy window. And that window, I think, ushers in kind of a new and stronger role, particularly for government, but also the federal government. How will public policy be different in the post-pandemic world? Well, I teach a class on poverty and inequality, and as part of this class, I do sort of a deep dive into the history of public policy responses to problems of poverty and inequality. And there's sort of like two lessons from this deep dive. One is that crises typically lead to expansions in federal government, and particularly the welfare state. And we saw this with the Civil War, with kind of the emergence of a stronger role of the federal government. We saw this with the Great Depression, with the emergence of the welfare state, the passage of the Social Security Act. We saw this in sort of the mid-century politics and policy around civil rights, which also brought a stronger role for the central government or federal government. And we certainly saw it during the Great Recession, where we get the ACA and a huge expansion of the role of federal role in providing health insurance and coverage. There's also another thing I want to mention, and that's that America is changing rather rapidly. There's now more millennials than there are baby boomers, and this is significant because younger generations want a more active government. They look more toward government to solve problems. And I just have some polling from Pew here. If we look at millennials, 64% say that the government should take a stronger role in solving the nation's problems. And among baby boomers, that's only 50%. So I think that that's likely to kind of piggyback on these other changes and really be an impetus for a bigger role for policy and a bigger role for government going forward.
Super interesting answer. How about you, John? And you're going to need to unmute, John.
Okay, I've got two kind of points to make. The first one is been made already, but it has to do with sort of the science side of this. I think there is no post-pandemic period. If you go back and look at some of the articles in the Journal of Immunology and others, they go back 15 years predicting these pandemics going way back. And they also, there's an article at least 10 years old on finding a universal vaccine. And there's been efforts put to that. Everybody knows about it. There's obviously a huge payoff for it. And I think that's where the government has to put their money, because you've got these things coming and you're seeing it already in the variants we're seeing right now. They're talking about different variants of this thing, Los Angeles variant, et cetera. So I think you've got to look at that, and you've got to approach it from a universal perspective. And there's a lot of scientific work on. One thing I was a little worried about is that these articles about 10 years ago were very optimistic that we were going to have it by this time, and it's not there. So I think that they were overly optimistic on how easy this is going to be. It looked like with these articles, it was around the corner in 2011, and it's 2021, and we're in a pretty bad shape. So that's one thing. The second thing I think that is, I would echo Geoffrey here, a little of Dennis as well. Federalism is a problem here. I don't think this was very well coordinated, what we saw here. And this is not a partisan issue or anything like that. It just wasn't coordinated very well. And and this is something, of course, La Follette research could really help a great deal. And we could write a lot about this, because I just think they have to figure out a way to coordinate this much better. We should be doing it better, I think, because we have a vast experience with Medicaid and Medicare, which are delivered at their Federalist programs. And for some reason, they didn't piggyback on those programs very well. At least it should be run through Medicare, I would think, or through Medicaid and Medicare together. And you should be able to coordinate this much better, because I think there's been a real problem in that. The efficiency is wrong. And there's also, of course, because of the thing, there's an equity issue. The federal government, as Geoffrey emphasized 2 or 3 times, there should be much more emphasis on equity. That has to come from the federal level. I think it does, at least, because the states are going to be so sporadic in terms of what they do. So those are the 2 things that I would emphasize.
All right, so we're going to move into questions now. And for anybody in our audience who wants to ask a question, our process is going to be that you can go ahead and you raise your hand, use the raise your hand function, and then we'll get some questions fed to me, and I will call on you. But I want to get us started with a question from one of our alums, Richard, who's a 1982 grad from Denver, Colorado. Welcome, Richard. And Richard asks, given increased political polarization and really hyper-partisanship recently, what kind of role can business play in strengthening our democracy? So again, Richard, our 1982 alum, is asking, given increasing polarization, hyperpartisanship, what's the kind of role the business might be able to play in strengthening our democracy? Denny, why don't you give a shot at this one to start off with?
Well, I think that business is starting to pick up on this whole issue. They recently have been trying to get everybody to kind of calm down, to problem solve, rather than just choosing people because they're Republican or they're Democrat and adding to the polarization. I think that they speak loudly with their contributions to campaigns. That's a major issue. And a number of them have been pulling back on that and using that leverage to get people to focus on problems. And it seems to me that they can also, I mean, one of the patterns in the past, and it to some extent continues, is using task forces and commissions that include representation from prominent spokespersons from businesses, small business and large business.
John, how about you?
Well, I think that Denny's right in this. The business side, first of all, the business side is already involved. I mean, they're the premier ones in the vaccines, and so if we're talking about a universal vaccine, that has to come from the business side with incentives, of course, given for the federal government to do this. But I think there's a pretty good incentive in the marketplace for those pharmacy companies. This is a universal problem throughout the world, so it seems to me that there's an enormous incentive to develop those vaccines. Also, I'm not so sure about the side of this thing where businesses actually, they delivered the vaccines directly to the governments. And I'm not sure that has to be looked at. There might be, seems to me there has to be a way where business might be able to connect directly with those people giving the inoculations and where the distribution center is. So that connection has to be looked at. I'm not sure that it should all go through government because it may not be as efficient or quick as done as quickly.
Geoffrey.
So, I mean, this question had to do with businesses and democracy. And democracy, when I hear that word, I hear voting. And so what can businesses do? Well, they can do what Coca-Cola and Delta are doing in Georgia and pushing back against some of these voting restrictions that are being pushed there. They can stop contributing campaign donations to politicians and PACs that support these sort of changes. And I think these sort of things are going to be highly effective in sort of limiting the damage that politicians can do in terms of limiting voting rights.
I want to switch it up with a question for Bobbi and Bob. So this question is coming in from Peter Monty, and he's asking, do you believe the stimulus checks will play an important role in the future of how the government responds to some of these economic shocks? Again, so Peter is asking about these stimulus checks that are coming out of some of the COVID relief packages. What do we think the policy impact might be of those checks?
Well, I think they play multiple roles. The first role, of course, is to give people who have been hard hit by the lack of employment and who might be evicted, the ability to, live with shelter and food and some other needed resources. It sort of it's a way of setting a floor so that people really don't have to be quite as stressed and fearful that they would, in fact, end up on the streets. So I think that the stimulus idea is one that is likely to really minimize, even though it's very, let me restate that. There's a huge cycle that's going on, and we are clearly at a point of great recession. And by having the stimulus, we're keeping that from being worse than it is, from going down even further. So in a way, it is trying to keep that the floor up. And I think the other question is going to be how we're going to pay for it and whether that's going to also influence some of the income distribution questions. But I think it's an active role of the government that is very much needed when the economy takes the kind of slide that has occurred due to the pandemic.
Yeah, I would certainly second that. The payments are a direct antidote to the increased unemployment and job loss and income loss. So they contribute mightily to the reduction in the hardship that otherwise would be occurring.
But they also will hopefully stimulate the economy and create more jobs. So it's not just helping the people who are hardest hit, it's also going to help the rest of the economy recover.
Yep.
But Bobby, there's one issue here. It's $150,000 for a family to get the stimulus. It seems to me pretty high.
And that's one of the things that we should all study is how high should
Yes,
it go? Exactly. I think
not
one
exactly
of the
targeted on the poor.
it's designed, but I'd like to look at it and know based on evidence rather than my thoughts. But my thoughts are that it gets cut off too quickly, so that I worry a little bit about the incentive effects.
150 to 160.
Design could
Correct.
be.
But also when you get to that level, people have health insurance, and so they have other ways to do it. So in some ways, I think you're throwing a huge amount of money, and when you need to target it down where we know where the people that don't have health insurance and access to health is, we know they're at the bottom of the income distribution.
But we have other ways of directly providing health insurance. And so there's a question about how to make that more effective.
I think this is a new model for one big reason. You can get it through Congress. Like all these other things, you know, not popular, easy to argue against, but everybody gets a check, or most people get a check. 85% of people get a check. I think that's really difficult to oppose politically. And for that reason, it's easy to do. It probably is effective at some level. I mean, I do worry about how targeted it is. I share John's concerns there, but you know, we'll have to study it.
So we've got a question from Tony Carroll, who, boy, I haven't seen in a while. Tony, welcome. You can unmute and turn your video on and ask your question directly to our panelists. Welcome, Tony.
Thank you. I'm not sure I know how to turn my video on, but I'll ask the question. Can you hear me all right?
Yes.
Great. I'm concerned that there's a growing interest in limiting the intellectual property rights of pharmaceutical companies developing vaccines and therapies and associated supply chain products through a WTO waiver, which many of you have probably read about. Maybe this is too arcane for some of the audience, but I'm worried that this pandemic is not going to go away. It may shift and shape in ways that we cannot predict. And it seems to me that we need to maintain incentives for science and industry to develop products that can respond. And I don't believe that IPRs are the issue pertaining to limitations on supply of vaccines. There are a lot of other reasons for that. And I think there are flexibilities within the WTO allowing for voluntary licensing that could be utilized to try to address some of these supply chain deficiencies. But I'm a little worried right now that this is starting to pick up some steam, and I'm thinking it might have a disincentive, if you would, for science and evolution of development just when we need it the most.
Anybody want to jump on Tony's question?
Gonna try. I recognize the issue that you're raising. Another version of it, of course, has been that the Gates Foundation has been very active in trying to make sure that a number of drugs are shared across borders for lower income countries through a not-for-profit distribution system. So there are a lot of concerns with gaining access, whether it's a vaccine or other new pharmaceuticals, or eventually ways to treat people who actually get a SARS or other diseases. So there is this big issue in wanting to create incentives for the pharmaceutical companies to come in. And if we limit the profitability, it may discourage a number of them. Alternatively, there are other models, right? There are models in which the public sector does more. It doesn't just do the baseline research, which tend to take place in academic institutions and is generally funded by NIH. And then the heavy development has traditionally been done through industry. So I think we've been too heavily allowing industry. And that's why we have such expensive drugs that people who need those drugs sometimes don't have access. That's both for new drugs and for Insulin is another example. So we do want to have ways to incentivize industry to invest, provide some of the direct costs, take away some of that risk. One of the other things we haven't talked about is the fact that if a company develops a new pharmaceutical, they can also be held liable if it has side effects. And so there's this issue, and we've had different ways of trying to limit liability, which also reduces the willingness of pharmaceutical companies and others to develop vaccines in general. So it is a huge area in which there are so many opportunities to improve policy. It is an open field, and I do share the concern. I don't actually know the particular policy that you're talking about, but I think the big issue is there, that we do want to have investment. We do want to have fair pricing so people have access. And we do have this liability issue as well.
Yeah, one thing I'd notice, I read this as being a sort of a miracle in the last year, what they've done. And that's been done in the private sector. They've developed this from scratch. So I'm not sure where the disincentive is for the last year. There seems to be some kind of an incentive out there.
mRNA, which is the basis of most of the successful vaccines, was developed in academia. It moved eventually to the private sector. It didn't start there. It was funded by NIH.
Yeah, but the drugs themselves to put into effect, Bobbi, were done by the pharmaceutical companies. The RNA work, of course, was done by academics and by medical schools and things. But there's been a terrific response through Pfizer and the other companies. It's hard to deny that, and I'm not sure they're actually giving they got 50 billion, I guess, from the government directly for the Pfizer. So that's got to be some sort of an incentive for. I don't know how much Pfizer needs, but I don't see this as a big problem right now.
It is interesting to think about sort of the public opinion on pharmaceuticals across this past year, which went from, the cellar to the ceiling,
Yes.
which is a fascinating politics case. We have another question from one of our audience members. Caitlin Marlott is with us. Caitlin, if you want to come on and unmute, and if you want to on audio too, whatever you'd like.
Sure. Hi, can you hear me?
Yep.
Great. Okay. I also don't know how to turn my video on, so I'm just gonna leave you here with this picture. It's so great to see you all, and thanks for all the work you do. I've been reading the newsletters, and I'm so impressed with all the research that you're doing. So thank you for that. So my question is, so as we approach, hopefully, a post-pandemic economy and think beyond these one-time stimulus checks, how can public policy play a role in meaningfully addressing racial wealth disparities? And is anyone at La Follette talking about or studying quality job creation and BIPOC entrepreneurship right now? Thanks.
Geoffrey teaches a really popular class at the undergraduate level on race and public policy. Why don't we ask Geoffrey, what does he teach his students these days?
I don't think anybody is at La Follette is studying BIPOC entrepreneurship. I will just share like my own perspective on this, and that is our sort of legacy of discrimination and racism has set in place conditions, and those conditions limit opportunities and impose constraints disproportionately on Black Americans and people of color. And so how do we address that? I mean, a big part of this to me has to do with residential segregation and school segregation. And I mean, those are sort of the two drums that I beat the hardest on with this stuff. And I mean, there's all this kind of talk about school choice, and we can let people choose their own schools, but we can also let people choose their own neighborhoods. And I think we're not going to see, a real end to this issue until we have integrated neighborhoods, until we have integrated schools. So the question is how do we make that happen, or how do we facilitate that happening? We have lots of housing programs. They do not need meet the needs of most people who are housing insecure. That is low income and paying more than a third of their income for rent or a mortgage. So I think we need a expansion of federal housing programs. And when we look at that expansion of federal housing programs, we ought to look with an eye toward racial and economic integration. And that's going to do a lot to solve the problems with school segregation. I just think I look at Milwaukee, where I went to school, and I was there in the 80s. I was under court order desegregation at the time, and I privileged to attend racially integrated schools. Kids growing up in Milwaukee don't have that opportunity today. So I'd like to restore that.
One of the issues we've talked about previously is the role of the federal government versus state and local. And I think here is an area where we really have to have the federal government step in much more than it has been. And that's a challenge because issues like neighborhoods and economic development and education have traditionally been the responsibility of states. We've talked about voting rights and the participation of people in democracy. And when states put up a lot of barriers, as they have been, when they're not sensitive, the federal government really needs to step in. If you ask yourself the question, if you're Black, if you're brown, should it make any difference what state you live in terms of your access to quality education, to having a safe neighborhood, to having a good job? I think the answer obviously is no, it shouldn't make any difference what state you're in. But right now, it really does make a difference.
Love when the political scientists talk about federalism. It matters, right? This is one of these ancient concepts that it affects us every day. We have another alum, Kathy Sykes from 1985, is asking our panelists about the American Rescue Plan. And Kathy wants to know a little bit more about how that plan affects poverty and might improve the economy. Kathy, one thing I'll say to you right off the bat is our colleagues, everybody on this call's colleagues, Professor Tim Smeating, Professor Sarah Halper-Meekins, have been all over the media on this very question, including in the New York Times. We'll send some links in our follow-up to this talk, but we also have Bobbi Wolfe on this call who can answer this particular question. Bobbi, how has the American Rescue Plan addressed poverty and affected the economy? And Kathy particularly wants to know a little bit about the inclusion, or actually exclusion, of the minimum wage as part of the policy changes that took place.
Okay, I was going to start at the other end, but I'll come to the minimum wage. And that is that I think the Act has taken the opportunity to pass a much better designed child tax credit. And to me, that's one of the most exciting components of the bill. And it's just there for a year, but hopefully it will get a lot of support and will become permanent, because it gives every child, the parents of every child, a lot higher income, which will allow them to start off in a much more secure and much richer resourced environment than is currently the case. So that to me is sort of the highlight. I think there's lots of wonderful things in this bill, but that's my favorite component. In terms of the unemployment, I mean, that was clearly something that was decided politically. So you shouldn't ask an economist to comment on the political decision. It seems clear that most people who have studied the minimum wage think that it should increase, that it's way too low now. We should also get rid of the laws that allow some of the service workers to be paid below minimum wage. There's also an issue of individuals who are not legal being taken advantage of and also not being paid even the very low minimum wage that we have. So I expect that communities will continue to raise the minimum wage. They're doing so right now. We're currently spending time in California where they tend to have a higher minimum wage. It's a very controversial area in terms of the research that's been done. I personally read the evidence is suggesting that we could certainly go to a minimum wage of $10 to $12 without having serious negative employment consequences. And so I expect that there will be pushes to increase the minimum wage nationally. But in some sense, because the cost of living does differ in different parts of our country, maybe it doesn't make sense to raise it up to something as generous as $15 an hour, given that in some places that would be very generous and allow, and just be a higher rate than businesses might be able to afford and would reduce employment. So I think there's likely to be some work on this. I expect that we will see changes. But first, as I just said, I expect to see more communities, more cities in particular, raise the minimum wage. You want to add?
No, I do not.
I would just like to say, I think, this child allowance is in for 1 year, but I should have talked about this when I talked about my kind of work through history of responses to poverty and inequality. Sort of another lesson from that is that anytime you put something universal in place, it's likely to remain.
Yep.
And this is not a universal policy, like it does phase out and all that, but it goes pretty high into the income distribution. So everybody's going to get benefits from it. It's going to be exceedingly difficult to get rid of for that reason. The minimum wage is tricky. I don't think they wanted to vote on a $15 an hour minimum wage. Part of that is that nobody really knows what the impacts of a $15 minimum wage would be. We learn about what the effects of minimum wages are by comparing what happens in a place that raises the minimum wage compared to what happens in bordering regions where that didn't happen. And most of the kind of minimum wage increases that we've seen have not been to levels of $15 an hour, particularly if we're talking about kind of lower wage areas. None of them have gone anywhere close to that high. Only like Seattle and San Francisco and New York City have gone that high. So economists really don't, any economist who tells you that they know what's going to happen with a $15 minimum wage is, they're just pretending, I think. So if it were left up to me, I would pick some kind of middling value in that, well, Bobbi said $10 to $12 an hour, I'd probably go to 12. And then let state and local governments set, a bar above that if it fit their.
I agree with Geoffrey. I'm just wondering what happened in the Democratic Party, why there seemed to be no effort to go down and negotiate for a lower. They stuck with 15, 15, 15. They wouldn't budge from that. And that seems to me, 725 to 15. Wow, that's a huge thing. And there must be something going on within the Democratic Party that's a factionalism from the left and the moderates that will not allow that compromise to occur, because that's an obvious thing. I kept waiting for them to say, why don't you go to 10? Go to 11, try 11. You can't get 11, go to 10, and go anywhere.
You need 60 votes. So it doesn't, it doesn't matter. If you get all the Democrats on board, you need some Republicans on board. And I don't think they're going to go for a $10 minimum wage or a $12 minimum wage.
You've heard it here, folks. There's a prediction from John Witte and Geoffrey Wallace. So we're going to see this again, and there's going to be some bartering around the minimum wage. We're got another audience question coming in. I'm told that we can hear audio, but not video. That's my fault. So we're going to hear some audio from Bob. Bob, you can ask your question now. And when you do, please unmute, Bob, and we'll hear you loud and clear. Oh, rats, I'm not hearing Bob. And so I'm going to ask a question from the moderator's standpoint. One of the things I wanted to ask this group is, when you look back in time at points in our history in the United States when we've faced major public policy challenges, maybe here in Wisconsin too, are there particular leaders that sort of stand out from the past who could serve as examples for our leaders today in terms of addressing major public policy problems. Dennis, why don't I start with you? I know you've written a number of books, including a wonderful recent book about Governor Lucy from here in Wisconsin. How about a past leader that would stand out we could learn some lessons from for today?
Yeah, thanks, Susan. The leader that I would highlight is actually someone that we used in our public management courses, and one of the Follette students did a nice study on, and that's Don Percy. Don Percy was an outstanding leader in the university. He was a cabinet member with Governor Lee Dreyfus, and he had a style of management that we found very informative and very attractive, where what he did is when he, for example, became the Secretary of Health and then called Health and Social Services, he frankly did not know much about what that agency did or what it should be doing. So he really invited his employees to come up with ideas, from which he said he would take 5 ideas and focus on that as an agenda. And he got some great creative ideas for not only an agenda, but also for problem solving. And then what he did, and this was kind of the lesson, was sort of, okay, rely on people who are frontline. They know what these issues are. Rely on them a lot for ideas, both in terms of agenda as well as solutions. But then once you've identified what you're going to do, boy, he was not at all somebody who was permissive or, I mean, he was a tyrant, and he very much insisted that deadlines be met, that people follow the plan, nose to the grindstone. And it was an interesting kind of mix of understanding the need for creative problem solving, but also for efficient and effective follow through and implementation and management. And Don, as I said, he became pretty famous in Wisconsin as well as nationally, especially for community-based services to the elderly and the handicapped. He became a head of the University of Wisconsin Credit Union, made it what it is today. He was a vice president with UW System, quite a guy.
Love it. So really showcasing that kind of flexibility in leadership and using your frontline staff to understand solutions to problems that confront us. Awesome.
Right.
How about you, John? Do you have any examples from your past history that you'd like to point to in terms of leaders who have really risen to a challenge in order to address a public policy problem?
Well, I have to mention Edwin Witty, obviously. That probably is the most important one, given the Social Security Act. And that entire group of people around the university at the time, it wasn't just them. At the turn of the century to about the 1940s, 50s, even into the 50s, there was enormous input. Before academics like myself didn't even know, I wouldn't know how to approach writing a law. They even wrote the laws. They were the people that wrote the statutes. And they know how to do it, and other people didn't because there wasn't staffers and things like that. So there was an enormous period of time early on, which has continued, I think, in a different way, because now we supply 2 things from the university. One is we train a lot of people, and the Follette is wonderful at this. Our people are all over this country, all over the world, and we've all had a hand in it. And we're very proud of that, I think. And I think we continue to do a very good job. I'm not saying I'm not strumming my horn here, but the entire faculty does a great job. And that proves a big service that is not available at a lot of universities, or not available as in the quality way it's available here. So I think that's a very, very important aspect of how the university's contributed, other than just in the policy way.
So we have another question from one of our attendees, Sarah from Fitchburg. And Sarah from Fitchburg is actually asking a question that I've been asking myself lately. I'm curious what this panel has to say about it. So she's saying that the Follette School curriculum taught our alums to really scrutinize policy alternatives, to think about the most valuable, the most effective, the most efficient policy alternatives. But then when this pandemic hits us in real life, politics and scientific tentativeness can really curtail or obstruct our ability to choose policy alternatives along those lines. So should our La Follette School education, public policy education, place more emphasis on politics, political communications, and persuasion in thinking about assessing policy alternatives? Geoffrey, why don't I turn this one over to you? I know you teach our policy analysis class at times. What would you say to Sarah in terms of her question?
I mean, this goes back to like why I cover history in my poverty and inequality course, and why I also spend a lot of time talking about politics. And indeed, I think I did that today, even though I'm an economist. I think it's really important. I mean, politics imposes constraints on what can get done, honestly, and we ought to address it. We ought to talk about it. Now, I'm not an expert in framing things or focus groups or how to make policies sound more favorable to a wider range of folks. I don't have training in that, but I certainly think it is worth thinking about those issues.
Bobbi.
I just want to give my favorite example that's in this. We know that the absolute poverty line that we use, which was set up in 1963, does not do an adequate job of really capturing poverty. And that we now have supplementary poverty measures, and we keep evolving and trying to improve that measure. But unless you know the politics, which is we can't start using the supplementary measure because it will change who is poor, and it may increase the number who are poor, and no public officials want to be responsible for finding that the poverty rate has gone up, or telling older people that they are no longer poor and therefore they don't qualify for Medicaid. So I think it's a perfect example of you have to understand the politics to understand why we don't have a better measurement. So it's important. It is an important component.
It's easy to be a benevolent social planner. It's like harder to actually get things done.
And Sarah from Fitchburg, you'll be happy to know when I teach the workshop class and we go through our policy alternatives, the political acceptability of the policy alternative is one of the required dimensions our students have to evaluate all of the policy alternatives by. So we are building that into our curriculum. John, I can see you wanting to add.
Well, I was just going to say, on the other hand, Bobbi, there's one thing that's defining the poverty line. And in fact, Bob might be better at this. In fact, getting it into law, it's the most important probable single measure, isn't it, in our social and economic laws of this country? And maybe it's defined wrong. We can't change it now because it's so ubiquitous, but it's still, what an accomplishment to do that. If you think about it in that sense, I think the University of Wisconsin had something considerable to do with that in the Poverty Institute.
And I might point out that we may not have explicit instruction on politics always, but boy, our alum include a lot of very successful politicians.
Politics and policy. Speaking of our alums, we have just about 7 minutes left. And so I want to give a chance for each of our panelists to answer one more question. And the question I want to put before each of you, now, y'all were chosen because you have, for this event, for our kind of kickoff event for Alumni Connections, because you've taught so many of our La Follette School students, you've touched so many lives. And given that framing, I want to ask this question. Do you have any words of wisdom for our alumni who are in the trenches right now, who are working to improve public policy? So again, what are your words of wisdom for our alumni who are in the trenches, they're working to improve public policy today? Dennis, why don't we start with you, your words of wisdom for our alums?
I have one word of wisdom, and that is network. An event like this is just so important because it continues to foster the network that exists and grows up when people are in the La Follette program and taking La Follette courses. It is just so important to have those informal ties with one another, to share ideas, to share experiences, It's something that is just so invaluable. And I'm sure that people who are in the webinar now and have had some experience know the importance of having those relationships. And so everything you can do to stay in touch with one another, do it.
Absolutely. And let me add, stay in touch with us too at the LaFollette School. We want to know where you're at, what you're doing, your wins and your losses. We want to know it all. Bob and Bobbi, let's move to you next. Same question. Do you have any words of wisdom for our alumni working to improve public policy?
Well, I'm going to pick up a little bit where Dennis just left off. And that is to stress the importance of being both a mentee and a mentor. And that part of the network that surrounds the Follette can hopefully facilitate individuals who are just starting out, young alums, having someone to turn to or having a group of individuals they can turn to sort of get a better feel of how to function in the world out there. And then older alums hopefully would be willing to mentor some of the younger alums in trying to tell them the things they've really learned that have been advantageous to them. So to sort of take some of the links of La Follette and use it to continue a relationship of in growth.
What fabulous advice. And in fact, if we can help make those connections for you, let us know. Don't be a stranger. We do have so many really gracious alums that are willing to share their path, and and sometimes it's invaluable. Geoffrey, how about you? Words of wisdom?
I do not. Anything that Denny and Bobbi said, I would only repeat.
Thanks, Bob.
So my words of wisdom is that change happens slowly, particularly in institutions of government, and so it's really important to have a long-term perspective on stuff. And it's like if you want to change policy, it might take years of work to do it, and that's just the reality of it. So don't be discouraged. Keep at it, and if something happens in 10 years, that's a victory.
A long-term perspective. Love it. How about you, John? Words of wisdom?
Yeah, just one thing I would say to most people, don't get discouraged. There is still a lot of negativity out there toward bureaucrats and the way it's done. Now, I don't watch a lot of those shows and things like that, but I know that it's out there. And I just hope to God it goes away, because government has been so essential. And I think people, as we get greater education, it's getting better, but it's still not great. And so for people out there, don't get discouraged when you read these sort of silly things.
Well, this is my chance to say thank you. Thank you to everybody who was able to attend tonight. So all of you out there, thank you for what you're doing on behalf of the LaFollette School, out there changing the world as our alums and our friends. Thank you to this panel, Geoffrey, Dennis, Bob and Bobbi, John. Thank you for everything that you've done. Thank you to Brittany and Lisa Ellinger, who have organized this event tonight. We are just thrilled to have all these folks connected to our wonderful school. That's what makes us special, is our people. To stay more connected with the LaFollette School, don't be afraid to go to go.wisc.edu/alum. It's a whole network of resources there for you. And also, we're going to have some additional alumni connection events that are going to be offered virtually. And then as soon as we can, we're going to get all back together again and do the kind of in-person networking that Dennis stressed as well. Thank you. Thanks for coming tonight. And this concludes our event tonight. Appreciate it.
Thank you, Susan.
Bye.